Then fly to home. But if you wanna travel, then go alone. Yeah, what's the point in us if I never know? Yeah, if you're gonna leave, I'ma let you go. I'm tired of the pain. Go away. I'm tired of yesterday. I fell where my demons dwell. My own little nightmare, I call it hell. Oh well, it's time to get back up. Climbing and climbing, I'm done with this ride, is what I tell myself, so I could feel something else. Yeah, I guess I had my bad days, but it doesn't mean I lost my style. Darling, where were you when my heart was on the ground? I thought time would prove that you would stick around. I guess time starts down, a king without his crown. Now I'm breaking and you're faking, girl. You never made a sound. I'm tired of the pain. Go away. I'm tired of yesterday.
Baby, wait, I know that you're afraid, but it'll be okay if you just stay with me. And we can run from here and we can disappear, and they won't find us where we are going, dear. So baby, hold on to me, 'cause I know I can make you believe in something that only we can see. Oh, so baby, hold on to me, hold on to me. Hold on to me. I just can't let you go. Lord knows that I've tried to. You said I was the only one. No one likes being lied to. You made this mess and left me with the pieces. Now I wanna burn all the bridges between us. I can't focus, I can't forget. I've been thinking too much lately. I just need to clear my head. I just need to clear my head. I've been stuck on your memory, but it's not like I need it. And we may have some history, but we don't have to repeat it. You made this mess and left me with the pieces. Now I'm gonna burn all the bridges between us. I can't focus, I can't forget. I've been thinking too much lately. I just need to clear my head. 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 I just need to. I just need to clear my head. I just need to. I just need to clear my head. I just need to. I just need to clear my head. I just need to. I just need to clear my head. I can't focus, I can't forget. I've been thinking too much lately. I just need to clear my head. Oh, clear my head. I just need to clear my head. I just need to clear my head.
I get lost inside my thoughts, and when I start to think, oh, the Tahoe closest starts to end up on the brink. I tried so hard, but all these scars, they cut so deep, I bleed. I fell so fast from heaven, it's like someone clipped my wings. Now I'm falling, and I can't see the ground. Can we stop this gravity? It keeps bringing me down. I can't breathe, and I don't wanna die. Can we stop this gravity? 'Cause I wanna say goodbye.
Hi everyone. I hope you can all hear me. I hope you can all hear me well. Um, we're about to get started here. Well, I've been having a few technical glitches, and we might not be able to do the video as I had wanted to do, but since we are gathered here, I just wanted to make sure I at least make it a meaningful time for us so we can just spend a little time. There's a lot going on around us, a lot of things, a lot of questions that persons have as it relates to health in general and specific things as well. So, what I'm going to suggest that we do is I'm going to suggest that we have give you guys a little time to ask some questions and see if maybe I could just do a Q&A and see if you can get something meaningful out of it. So while we're here, if you have a question to ask as it pertains to health, broadly, any topic generally, but hopefully something that I can answer, I'll be glad to try to go over it. Now, it will be more meaningful, I think, if we ask the questions via the chat. So that way I can see it quicker and answer sooner. Because if we wait for me to, well, I mean, there's no way of me hearing you anyhow. But the best way is by you doing the chat and then I respond to each question as we go along. I know a lot of questions are circulating there, and let's make it as meaningful as possible, shall we? And maybe we'll even end by, it depends on how it goes. If it's going very well, we'll go a little bit later. If not, we can probably close off by about 7 or so at least a half an hour of good interaction between us. So let us kick it off. If you have any questions, feel free to raise it now, and we shall see where we go from there. Chiropractic benefits. Okay, let's see here. So we have a question here from Rashad, and it says, "Are ankle braces good for healing ankles faster?" That's a very nice question, because what we find is that a lot of persons, they end up wearing some kind of a restrictive device to assist with recovery. But the answer is kind of a compound one, because if you wear an ankle brace, for example, and you are walking around, climbing stairs and what have you, if your ankle injury is of such that it is because of some kind of an instability. Some ligaments may have gotten damaged, and while you are trying to recover, you still have to move around and do your day-to-day activities. And so you find that if you do walk on the ankle, it may hurt. So by wearing a brace or some restrictive device, it may take the pressure off the ligaments to allow you to be able to walk. So in that case, it may allow the ligament sprain or strain to heal. But as soon as you're able to get out of the ankle brace, you need to, because two things will happen. One is the muscles that are supposed to be there to help to stabilize the joint will not do their jobs efficiently because of the presence of the brace. And so, since the brace is doing the job, then the muscles that should be doing that same job will not fire appropriately. So that might cause a problem that may result in future sprains or strains much easier. The second issue is that by wearing the brace, you're also shutting off the communication between your brain and the ankle, and the way that they talk to each other to let your foot know or your ankle know how to position itself depending on the terrain, depending on the activity, depending on what your desire is to do. And so we call that proprioception, which is the awareness of your body in space. And when you're wearing a restrictive device that reduces the motion of a joint, then instead of the brain being able to see the ankle specifically, it may see the entire foot as one solid entity, and so not be able to achieve the same kind of a control that it would otherwise achieve. And so if you're walking on uneven surfaces, you are more likely to roll your ankle or twist your ankle because your brain is not able to adjust for the changes in the terrain because you had to be wearing that brace for an extended period of time. So yes, the brace can help in the recovery phase of an injury, but as soon as you're able to get out of the brace, it is recommended that you get out of the brace so that the ankle can get to function or fire more normally. I hope that helps. So that's a good question. Anyone else? Any other questions? I know as soon as we start asking more, then more persons are going to start jumping in with their questions, and we'll want to be able to answer those. Um, Welcome, Maxine. Welcome, everyone. Welcome, welcome, welcome. So, Judith is asking what causes the crunching sounds in the knee? That's a nice question as well. And so, I don't have a model to show you. Maybe I can bring up one on the screen and show you that way. Um, so I'm just looking for a nice little diagram that I can use. All right, I'm going to try to see if I can bring this up here. Just give me a second here. Let me try to find. All right. Okay. So let me just kind of kick over to this diagram here, and hopefully I can get this thing to work. Hold on, let me see. Yes. All right, so if you look at the surface of the knee, and I'm not sure if you're able to see my cursor or not. Yeah. So if you look at the surface of the knee, this is the cartilage from the femur, the thigh bone, and the cartilage from the bottom bone here, the tibia. Now, the surfaces of the cartilage is supposed to be very, very smooth, and like, it's smooth. It's extremely smooth, almost frictionless. And they're designed to glide across each other as you bend and straighten your joints. The problem is, over time, the joint may start to break down. You may have an infection that causes damage to the joints, as in chikungunya. You may have an injury that may cause the damage to the joint. If the cartilage starts to, get irregular in shape, it might get rough in its appearance. And if it gets rough in its appearance, what may end up happening now is that the cartilage, instead of moving smoothly and freely and frictionlessly, starts to make a grating sound as they rub against the two surfaces rub against each other because of the roughening of the surface. And that is what you will hear as far as a grating noise that you will hear. Sometimes you're bending your knees and you hear creak, creak. It's because the joints are wearing down, and it's causing them to rub unevenly and result in the joint not functioning the way it should. And interesting note is that this kind of a situation actually happens very, very frequently and results in persons having long-standing issues. It can also result in the person losing the ability to control that joint, and it may end up causing them to lose a joint, resulting in a replacement that may be needed down the road. So that's a very nice question. I like that question. So another question is from Maxine. What would you recommend for OA, osteoarthritis? What would you recommend for OA? Well, osteoarthritis there are different types of what is called arthritides. And by arthritide, I mean types of arthritises, if you will. But it's not that, it's arthritides. You have some that are caused by an inflammatory condition, like somebody who has rheumatoid arthritis. They have inflammation in the joint because of an autoimmune situation. The body's immune system is attacking the joints itself and damaging the joints, because the immune system is very powerful. It can destroy a lot of things, and when it turns on the body itself, it can destroy the tissues of the body. And so if you have like rheumatoid arthritis, that's what happens. But there's another type of arthritis, which is the more common type that affects a lot more people, and that is what we call OA, or osteoarthritis. With osteoarthritis, then we end up in a situation where a person will have the joints of the body will start to wear themselves down. And this happens if there's an injury. Let's say you're playing netball and you were knocked down and you fell on your knee when you are 13 years old or 15 years old. 20 years later, at 35, you start to have knee pain. This knee pain, if you go to the doctor, they do an x-ray, will show that the joints of the knee are wearing down, and they ask what had happened, and it turns out that it's a fall from 20 years earlier that caused the joints to wear down. And when it wears down as a result of trauma like that, it's what we call osteoarthritis. Osteo means bone, arthritis means inflammation of the joint. So it's the bones that cause inflammation of the joints. And with osteoarthritis, obviously pain medication is not the answer, because medication is not going to stop the joints from rubbing down or wearing down each other. You have to reposition the bones back to their original alignment so that the joint function is restored as much as possible. And this is true whether the injury is old or whether the injury is new. And what many people don't realize is when you have a new injury and the bones get shifted out of alignment, if you do not realign those bones and get them lined up properly again, then what ends up happening is the bones will rub themselves down and they will create problems for you down the road. So this is not necessarily a good thing to have happen. So great question. You know, a lot of people, what they do is if they have a fall or they sprain something, the first thing they do is take medication, and if medication eases the pain, they back off. But you know what? It is far better to actually, instead of waiting for medication to ease the pain, to see if you can reposition the bone. Because if you ease the pain without repositioning the bones over time, or realigning the joints, then over time the joints will wear down and you will develop arthritis. It's just a matter of time. One of the most common ways that arthritis develops is in the spine. And if somebody has had a car accident or whiplash injury, for example, it's almost a guarantee that the bones have been shifted out of alignment. And if you do not realign those joints in your spine, it's going to cause osteoarthritis in your spine. Now, osteoarthritis in the spine has a special name. Some of you may have heard it before, seen it on a report, and not realize what it is. But osteoarthritis in the spine is called spondylosis. Spondy, S-P-O-N-D-Y, losis, L-O-S-I-S. Spondylosis, one word, is osteoarthritis of the spine. So that too is important. All right, so there you have it, Maxine. Hopefully that helps. And good evening, Aisha. We're doing a Q&A. We're doing a Q&A here because we want to make sure that we are able to assist persons in dealing with questions. So Rashad has another question. It says, I've heard people saying that if you're a back sleeper, you should sleep with a pillow under your low back and knees, but I feel a lot of pain in the lower left part of my back. Well, if you sleep on your back, you ought to have some kind of a pillow to prop certain joints up. And that's because when you're in that back position, it can put a strain on certain joints depending on the support that your bed offers. Some people, their mattresses offer good enough support, the right amount of support, that they don't have to worry about necessarily propping up joints with pillows. But if you're on your back, it's good to have a pillow. I'm going to try to see if I can bring up something here to show you. I'm trying to see if I can find a chart that we use here in the office. because it does show nicely how you can position yourself with your pillow. But nonetheless, it is important that you, when you're using your pillows, that you position your pillow in such a way that the pillow is somewhere above your head down to about this level here. So from your upper back up above your head, so that when you lie on the pillow, your entire body is on an incline. Well, not entire body, but your upper back and your head are inclined together. Because if it's not inclined together, then what ends up happening is if you have a pillow under your head, it will tuck your chin forward and stress that neck. And so we highly recommend that you do not just put a pillow under your head, but if you're on your back and you're going to use a pillow, put the pillow under your shoulders to include your head, so that your head is supported on top of the pillow with your upper back. That will give you that nice angle, that inclination that you want to, especially if you have acid reflux or any condition like that. It can increase that angle so that it takes the pressure off that upper back. And speaking of acid reflux as well, with acid reflux, what is important too is being able to know what can be done to treat somebody who has acid reflux. And it is unfortunate, I think, the way that acid reflux is treated typically. And I think it's the standard method of treating acid reflux is I don't want to just say incorrect, but it causes a lot more damage than it causes benefit. And I'll explain. And let me see if I can at least show you an image here while I talk to you, right? I'm going to try to bring up an image here. So if you give me a second, I'm about to add it here so you can see, because I really want you to be able to see how acid reflux actually works. And let me just add this here. So almost there. All right, so give me a sec, because it's important that we understand how this works, because a lot of people get themselves in all kinds of, mess because of it. All right. So let me show you how this works, shall we? When you look at, for acid reflux, for argument's sake, for instance, the esophagus, which if you look at the top of the screen, you will see that they've, kind of cut the esophagus. So that top part where you see called the esophagus, that top part of the stomach, that bean-shaped bag right there with the fluid in it, that's it, that's the stomach. Inside of it is the contents of the stomach, which is acidic. Then there are some muscles on the inside of the esophagus at the top of the stomach that should remain closed whenever the stomach is active. In fact, it generally should remain closed unless food is passing through. So if food is passing through, then what ends up happening is the food, or the food will cause a reflex opening of the sphincter that you see there at the top that allows the food to enter the stomach to be digested or to start the process of digestion. If that sphincter is not able to close fully, then the contents of the stomach will splash up into the esophagus and cause the burning that you will feel that we call acid reflux. Sometimes it can come all the way back up into your throat, and sometimes you can even spit it up or throw it up or have a little small vomit. Well, the way that the esophagus works, it's really a one-way street at a time. So if something enters at the top, it will be pushed down through into the stomach, which is what we call swallowing. And as it gets into the stomach, then the stomach will do its job. Now, the problem is that when that sphincter is not able to close, the stomach contents can burn the inside of the esophagus. We call that the heartburn. And it's not because of the acid in the stomach, but because the sphincter is not closing properly. That is the problem of acid reflux. And a couple of things can cause the sphincter to not close properly. One is the muscle controlling the sphincter is not able to close or is not working. And if that sphincter is not working, this person spelled sphincter incorrectly, but it's all right in the diagram. But if the sphincter is not closing properly, then the contents will cause the damage. If it closes properly, then it doesn't matter how acidic the stomach is, it will not cause a problem for the esophagus. In fact, the more acidic the stomach is almost the better it functions, and not the other way around. And if you take an antacid or something to block the production of the acid in your stomach, you're going to destroy your ability to digest your food, and it's going to cause absorption problems for minerals, for proteins, for things like iron, calcium, vitamin B12. You're going to destroy the body's ability to digest and absorb most of these things. And so acid reflux medication that targets the stomach is a bad idea. The best thing to do is to try to correct the cause for the sphincter not closing. And we at our office here, we have methods that we employ to actually be able to get that sphincter open again, so start to get it to close again when it's supposed to, so that it prevents the stomach contents from burning into the esophagus. And that is extremely important. All right. And to finish answering the question by Rashad, we don't recommend that you put a pillow under your back, unless of course you have a spring mattress that is very saggy and it's causing your back to kind of get into this hollow out position. So you might want to put something there to kind of neutralize the spine, but generally speaking, we don't recommend that you put a pillow under your back if you're lying on your back. So that's a very nice question. Thanks again for that one. Any other questions, anyone? Feel free. You might as well use me while you have me. Let us take a quick sip. You're very welcome, Paulette. You're very welcome. Anything else anyone is curious about? Anything anyone wants to ask? I like this. I think we probably should have this opportunity, because where I get to interact with you, my patients, directly, because my time isn't available enough to be able to call each person and answer questions and engage you that way. So I'm very grateful for the opportunity that I have tonight. It was supposed to take one format, but I really like this one because it has revealed to me the value and the how easily it will be for me to really reach out to the majority of my patients to just spend some time answering questions that you may have. And so while we're here, please, even if you're not a patient of mine and you just happened to join us randomly, feel free to ask a question. Maybe I can help to answer it, and it will probably help somebody else. So Tamara is saying, on the topic of acid reflux, why is there a pain and heat in the stomach? Well, the stomach is not okay. So we have to clarify something first, right? Because in Jamaica, we call the entire chest area, we call that the stomach, generally speaking. But the stomach is the organ within the chest. And the stomach is properly lined with a mucous membrane, a mucous layer that protects the stomach walls from the acid itself. So the acid doesn't digest the stomach itself because of that protective layer on the inside. But the esophagus does not, or the swallowing tube does not have such a protective layer. So if the entrance from the esophagus into the stomach is not closing properly, and it allows the stomach contents to go into the esophagus, because the stomach contents are acidic and the esophagus is not protected, then it will cause the burning of the esophagus, and that burning is irritating. Just as if you burn your skin, it will cause pain, then burning your esophagus will also cause pain, and this is what causes the burning pain that people will experience. Does cricking the fingers and toes affect your joints? I may have missed this. Well, Aisha, nice question. And I, I think the adage that cricking your fingers causes, they say that it causes arthritis, right? And swelling of your joints. I don't know if anybody cricks their joints as much as I do. I crick my joints all the time, and my joints, my fingers are very tiny, very thin, and yes, my joints have a little swelling. I suppose it's a little bit larger at the knuckles, but they're very bony fingers, right? Not very much fat there to make my fingers nice and smooth. But I think, and I've been cracking my knuckles for a long time, to say the least. But the thing I think about cracking fingers, cracking your joints, and I haven't really looked at any studies, and I'd love for somebody, if you've seen studies out there, to just pass it along. So what I'm about to say is completely my opinion. My opinion is that cracking knuckles is annoying to a lot of people when it's not their own knuckles that's being cracked. And because it's annoying, it causes people to want to stop other persons from doing it. So the best way to stop people from doing it is doing something, is to instill fear in them for doing it. And if you instill fear, then they will not do it, and hopefully not annoy you. And so what we find is persons are told, if you crack your knuckles, it will cause arthritis when you get older. Obviously, there's no way that they can know now whether arthritis will develop later, but because of the fear of developing arthritis, then they cease and desist from the action. And by ceasing and desisting from the action, it achieves the desired outcome, but then it also promotes an idea that becomes, endemic within the population. This idea is similar to, if you break a mirror, it's 7 years bad luck. No, if you're bad lucky for one day, it's bad. If you're bad lucky for 2 days, it's if you're bad lucky for a week or a month, it's bad. But 7 years of bad luck, I can't imagine, right? And when they tell people this, I think that is to cause persons that if they're carrying a mirror, to be extra careful, because nobody wants 7 years of bad luck. And so it makes them more alert and aware that they need to be extra careful when they're carrying a mirror, because they don't want it to break. The next thing is opening an umbrella indoors. These are all myths that I think are there just to cause fear, to prevent persons from doing a particular action that might be harmful. So with the umbrella indoors, an umbrella clearly is an outdoor invented device. And because of that, it's not designed for closed, enclosed quarters. So when you open an umbrella, you know how the umbrella, the canopy of the umbrella is very, very wide. And some are wider than others. In your home, if you have an umbrella open, the likelihood of you knocking over your mother's new figurine, or the glass on the table or something, is very high. And so what we encourage people to do is we tell them, if you open umbrella inside, is bad luck, right? And it's really bad luck because you may knock over something. That's why it's bad luck. So these things are, I think, old wives' tales. In the same way that they say cracking the knuckles will cause arthritis. Because if cracking the knuckles would cause arthritis, then a chiropractor's job of cracking the spine would be very dangerous for the spine. But persons who've been under years of chiropractic care, it doesn't show that it increases their likelihood of developing any kind of arthritis as a result of the adjustments themselves. So I hope that helps. Sharon is asking, what can she do to allow the sphincter to close? And that's how sphincter is spelled, by the way. Just so that you all know, it's SPHINCTER, sphincter. And now for the sphincter to close, one of the ways that we do it is if it is that it's staying open because of a hiatus hernia, which is when the stomach descends into the stomach descends into the opening between it and the lungs. I'm going to try to bring up a picture here. Hiatus hernia or hiatal hernia. Let me see if I can get a nice, good image of it. All right, I like that image. So I'm going to show you this one, hiatal hernia. All right, so let me show you what this looks like, right? When you have the stomach The stomach actually sits right below the lungs, especially the left lung, and between the stomach and the lung is your diaphragm muscle, which is a band of muscles that it separates your abdominal cavity from your lung cavity, and it also allows for inspiration to occur, or breathing in to occur. When that muscle contracts, it gets flatter, it causes air to rush into the lungs, and then when it relaxes, it goes back into a dome shape, allows air to rush out of the lungs. As far as it relates to hiatal hernia, the stomach, and if you look at the side on the right hand side, the image on the right, you will see that that thin muscle there that is on top of the stomach, there is a bulge that's taking place within the stomach itself that's causing some portions of the stomach to seep or push up through the opening of the esophagus, now occupying the space where the lungs should be. And that weakening situation is problematic because it will cause a difficulty for the sphincter to close properly. So that is something of import. I wonder if I can. I'm gonna try to. I'm gonna try to do something here to try to make it to point my finger in the direction of that thing a little bit, right? So let me come out of this here. Let me come out of this here and see what I can do, because I want to kind of be able to point a little bit. All right. All right. All right. All right. So I'm just trying to bring this up here. All right. So all right. So I'm trying to do something here. Something's wrong with me. Anyhow, here we go. All right. So I'm trying to point here so you can see what I'm pointing to. But right here, where right, this arrow is, this part here, this is the diaphragm, that goes right from here and across here. This is the opening between the diaphragm. And if you look, let me get my head out of the picture. So if you look right through here, this is where the sphincter would be. And because of this bulge right here, as the stomach pushes through, it's called a herniation. It's a hernia. So the stomach has herniated, and that opening is called the hiatus, hence hiatal hernia. When the stomach pushes through here, it puts more pressure on the esophagus, the sphincter, and causes that to not be able to remain closed, and then the contents of the stomach may push through, causing the heartburn. So one reason for heartburn is the hiatal hernia being a problem. The other reason for heartburn is the nerves that control the muscles of the esophagus are not working properly, and that usually happens as a result of some kind of nerve imbalance. So nerves control muscles, and if you have the nerves not working properly from this that go to the esophagus, it may cause a problem. Where do those nerves come from? Those nerves come from the cervical spine. They come from the neck to control your esophagus and your upper back. So if there's an issue with those nerves, then there can be an issue with your ability to swallow. This is how chiropractic helps with this condition, because if the bones are out of alignment in your neck, that's irritating the nerves that control those muscles, then we have to just simply realign the bones, and then it goes back to normal. So this is something that we treat pretty regularly, and with a fair amount of success, I should say. So there you have it for that one. All right, let's see what we have. Let's see what we have here. So Neris said that she drank rosemary tea and it helped with the acid reflux. I'll tell you something else that helps with the acid reflux, Neris. But rosemary tea, that's a great tip. I never knew of that. And so we can try that. I'll try that with patients of mine in the future. But persons with persons with acid reflux, a nice thing to do is just before you eat, a half an hour before you eat, you'd use a tablespoon of apple cider vinegar in a glass of room temperature water and drink that just before you eat, half an hour before you eat. And it usually prevents acid reflux from coming on in the first place. What it does, and you may wonder, why would you drink something acidic to help with acid reflux? And that's because when you add something acidic, it makes the sphincter close even more tightly in response to the presence of the acid. And so by closing more tightly, then it can do its job a little bit better. So apple cider vinegar, 1 tablespoon of apple cider vinegar, half hour before you eat in a glass of room temperature water. When I say a glass, like an 8-ounce glass, or half a glass or whatever. It doesn't have to be specific. It's just to get that in. And then you wait a half hour and then you eat and you should be fine. But there are treatments. It needs to be solved, not just gradually or passively managed. It needs to be solved as well. So these are things that we should look out for. And these are things that we actually can do. So it should be solved as well. For someone who is overweight, Rashad asked, and would like to lose weight whilst building cardiovascular endurance at home, what would be an ideal training plan? All right, going into that level of detail as far as training plan is not something that I think I can go into. It's a very specific thing, and it's specific to the individual, right? Because what might work for me might not work for you. So it's specific to the individual. So I'd recommend that you speak to either a trainer, personal trainer at a gym that is knowledgeable on nutrition or knowledgeable on how the body works to be able to guide you. Yeah, that might be the best way. That might be the best way to guide you. Not for me to tell you about that, so sorry about that. Next question is, can an alignment be done in one day? And is there fluid or toxins, I guess this is releasing from the spinal area? Not sure how to answer that one. Yes, spinal adjustment can be done in one day. Typically, it only takes about anywhere from 5 to 10 minutes for an adjustment to be completed. But as far as it pertains to releasing of toxins from the spinal area, I don't know of that to be the case. I'm not sure which toxins will be released. But when you do align the spine, you do improve the function of the body overall, which means that you may also improve the natural responses of the body when there's an infection or an attack. And so these responses will allow the body to now start to shed toxins or infectious agents, get rid of them from the body as the body is in a better state of balance. But as far as the spine releasing toxins from the adjustment, not sure how to answer that. So should somebody with diabetes be using ginger in their food and drink? And the answer is yes. Ginger is a brilliant anti-inflammatory. It has a lot of antimicrobial properties. It has a lot of soothing benefits for the stomach and so on. Ginger it's not quite a miracle food, I don't think, but it's a very good food to have. Anyone who is diabetic should be free to use ginger, but if you're using the ginger or drinking ginger tea or having ginger in your meals and you're diabetic, I'd suggest that you speak to your family doctor if you're thinking about starting any kind of nutritional regimen, to make sure that they understand your situation, so they'll be able to guide you as to whether there's a problem going on with you that may affect or be affected by the medication that you're thinking, the nutrients that you're thinking about taking. But the difference between nutrition and supplementation is that nutrition is generally non-chemical in nature, if you will. It is more natural. It's more in tune with how the body works, and so it doesn't usually create certainly the changes that can be created with a drug. Proper nutrients won't create that immediate change, but it can create a change. And so if you're taking ginger and other fruits and vegetables, especially fruits and vegetables, it will can help to stave off or to calm down the ginger process. Triona says, should we look forward to ongoing improvements after realignment treatment, or will we get to an upper limit of that during the process? Okay, so you have three levels that you can get to. I'll start with the most undesirable level first. The first level, that's the undesirable level, is the level where somebody encounters a treatment that is harmful to them or bad for them or irritating in some way. If it does, then the situation for the individual may actually worsen. It may actually worsen. And if that is your situation, then clearly you have to communicate that with your family doctor so that they can back off or change the process, right? As far as it relates to the other two options, it can be that you get their realignment and it improves your situation, but because your situation might not be fully reversible, it only improves it up to a point. We call this point maximum medical benefit, where you've gotten to the maximum benefit that the treatment can, or maximum chiropractic benefit, or maximum therapeutic benefit, which is where you get to the maximum benefit that you can get to while being under care. The last one is full resolution, which can happen especially in the earlier phases of care, where persons, they um, get on the care quickly. We do our treatment, and it's able to reverse completely the injury or the challenge that they had, and then they will get back to normal, fully normal. But the problem is that you don't stay fully normal indefinitely unless you're doing things to maintain it. Even if nothing has ever happened to you, if you don't take care of your spinal health, you're going to end up in a situation where your body's going to break down, and when it finishes breaking down, it won't be of much use for you. So you have to make sure you're taking care of your spinal health. I hope that answers that question. So usually improvements are slow and steady until you get to that maximum benefit. And hopefully that maximum benefit is when you're fully resolved. So hopefully that helps. Okay, any other questions? Just waiting. I'm just going to give you a couple more moments and allow you to be able to jump in with your questions if you do have any, because it's almost 7:30 now, and I'd like to just kind of wrap it up very quickly here. But like I said, it's a real blessing to be able to share with my patient population. I like this idea. It's totally unscripted because it wasn't. We were planning on showing a video, but we were having some technical issues bringing it up. So we've decided to do a Q&A instead, and this has been working out well, right? So Rashad says when he lies on his back, he feels pain in both ankles, but when he walks, he doesn't feel pain. He doesn't feel anything in the left ankle. That's a good tip that says that the problem is not your ankle, sir. Because if your ankle is the problem, then whenever you use the ankle, it should hurt. Should it not? And so you find that if you are walking and it doesn't hurt as much, or it doesn't hurt at all, but while you're lying down in bed it comes on, then it might be something that is irritated while you're lying down that changes while you're walking. One of those things that can happen and can explain this is a lower back injury. So if you have a problem with your lower back, and the nerves from the back that control the ankles, you may irritate the nerves that go to the ankles and cause the pain in the ankles, when in reality it's not an ankle problem, but it's a nerve problem from the back. So hopefully that helps. Hopefully that helps. Anyone else? Yep. I see that answer, Rashad. And it makes sense because when you have a low back problem, if you irritate the back, then you may irritate anything in the area controlled by the nerves that leave that area. And in our case, we were just talking about the ankle, and the nerves of the lower part of the lower back does affect the ankle. So yes. Well, indeed, it was a pleasure getting to spend time with you. I wish we had the opportunity to watch that video, but as it is, we will get that opportunity another time. Right now, I'm leaning more towards being able to have this time. And today is the 5th Thursday in the month of April. And as a 5th Thursday, it might be of benefit to point out that Every first and third Thursday of the month, we do have a patient health workshop, which is a class that we have where we invite our patients to participate. It's a PowerPoint presentation, and I believe that many of you have already been on it. So if you've already been there, great, you may continue. If you've not been there for a while, or joined us for a while, you're welcome to join us as often as you want. Since we're not providing food anymore, there's no restriction as to number. So you can join us on YouTube here anytime you wish when we're having this class. It's every first and third Thursday of the month, and today is the third Thursday. This is the fifth Thursday rather in April. And so if we're gonna have this Q&A time, maybe the fifth Thursday of the month might be a good time. It's not every month, so it gives me a little chance to recover, and it gives us a chance to build up enough of the patience to determine, if it's worth our time doing. And believe me, if there were one person here tonight, I would still have stayed on for you to answer your questions until you had no questions. All right, so thanks again for your patronage. I thank you so much for taking the time to be with us. And for those of you who made your appointments a long, long time ago and still stuck it out to come and see us, I appreciate that so much. We're trying to put changes in place to help us to be able to manage that situation, but as it is now, we're not able to. So I'm very grateful and thank you so much. When that time comes and we're able to find a new doctor to come in and help us, then that's okay. We'll be able to take advantage of that. So thank you so much, and thank you, Donovan, for being on. And do enjoy yourselves, everyone. Have a wonderful, wonderful day. Have a wonderful night. And don't let the stresses of the pandemic get you down. And certainly, the most important message, and I'll give one message since we are going through that, and I have a lot of you guys here listening. The most important thing that you can do to protect yourself, that's more guaranteed than not, is vitamin D. D3, vitamin D as in dumpling, D3. Vitamin D has been demonstrated to be probably the single most important factor in determining if somebody has to go to the hospital or go into the ICU following contraction of COVID-19. Vitamin D. So I'm going to recommend that every single person be on a vitamin D supplement. And generally, if you're on about a 4,000 IUs of vitamin D, that should be enough to keep you well. So 4,000 IUs of vitamin D. All right, and if you do that, your blood levels will be high enough. And if you do contract COVID, chances are you will not even go into the hospital. You won't need to go into the hospital because your body should be doing well. And I don't know why we have not been hearing about this in the media, but it is what it is. All right, so I wish you all the very best, and thanks so much for participating. And you guys all take care. Good night, everyone. I wonder if I can find the shortcut for micro. Alright. I'm trying to get this here. Ah, there you are. 0177. Let me see if I can show that to you. Alright, so alt 0177. Nope, not that. Zero 0181. There you are. And so I've sent the information online per day. Alright. And it's best with a meal. Especially something with a little fat in it. So alright guys, take care and I'll see you soon. Don't forget to hit that subscribe button and click the notification bell so that whenever we are online, you'll be notified and you'll be able to participate with us. Thanks so much. Have a wonderful day. Bye bye.